Well, good morning, everyone. And I have to say, I was real excited to come up here, drive through the traffic, get to my table, and see this. And I was like, gosh, the Department of Health has put matches on the table? So let me just assure you, it's mints. So it is great to see actually all of our partners, whether they're from the DEP world, our mosquito control commissions, our local public health partners coming together. I just want to thank everybody from the NJACCHO as well as the department for working together to put on today's event. You all know, time after time, you're dealing with vector-borne diseases and you're addressing them, you're keeping your focus on them. We really appreciate it. We have at times different emerging sorts of viruses that come and grab everybody's attention, or they really grab our attention because they're first, viewed as sort of worldwide threats that could come into our country. And even when we have these and we're not sure if they're going to cross into the country, you continue to remain focused. You develop new protocols and you go out and you do what needs to be done. And, you do it because of the types of partnerships you have. And that's one of the things that's great when you come to these conferences or when we're in our own meetings and they're just intergovernmental, is seeing the collaboration and the partnerships that take place at all levels. We really appreciate it. So, Commissioner Martin, thank you. Thank everyone at DEP. Department of Health is so thrilled that we have such a great relationship with you all and that it continues. And it's really because of the leadership you've shown. So thank you. I also want to just quickly acknowledge Shireen Semple, who is our Director of the Office of Local Public Health, and as you know, is a gigantic advocate of the work that you do, and has probably been one of the best leaders and examples of collaboration from the department. So we're really fortunate to have her in the newer role of the Director of Office of Local Public Health. And we're really fortunate that she's actually focused on issues that are critical to all of you. When we take a look at what's happening with Zika, and remember, we started this process about 1.5 years ago, we knew that there was a problem. And luckily, I would say it's because of the efforts that we've undertaken that it's a problem that, that for New Jersey remains something that's a travel-related issue. And I'm not going to go into the swim lane of Commissioner Martin because he's going to talk to you about what it is we need to do to ensure it remains travel-related. I'm going to come at it today from just a Department of Health context. And I will say that, because this is about Zika today, that's what I'm going to talk about. But we do recognize that there are other things like West Nile and chikungunya that we are going to have to remain on top of and are going to still remain something of, tremendous importance to all of you. But we're going to, focus on Zika. So from there, I just want to say we've seen a lot of developments take place. One of the things that we have seen in particular is how it impacts infants. We know that the highest risk for microcephaly is likely to occur in the first half of pregnancy. We know that approximately 1 in 10 pregnancies that have lab-confirmed Zika virus infection result in an infant with a Zika virus-associated defect. So, we keep telling our other partners in the maternal and child health fields to make sure that they utilize our birth defects registry and that we're tracking what's happening. Because the other thing that we don't know, and I'm sure we're going to hear from the CDC, is what are going to be the impacts on children if they have a lab-confirmed test. What are the impacts as they start to age? None of us really have our hands around what happens in the first 3 years of life. And that is going to be something we're going to need to keep track of here in New Jersey. We know that we've seen localized transmissions in the continental U.S. in both Florida and Texas, and that we have a large number of travel-related cases around the country. The risk of local transmission of Zika in New Jersey remains low. And I've got to say it remains low because of the efforts that you've all undertaken and because of the leadership of DEP, who continues to prioritize mosquito control. We know that we in New Jersey have the 5th largest number of cases of travel-related Zika. So we've got a lot of facts coming out here, as you're hearing. We have 244 travel-related cases of Zika, 5th largest in the country. We know that there is also that we have mothers, pregnant women, who have tested positive for Zika. We know that 35% of our travel-related cases actually involved travel to the Dominican Republic. After that, we know that it involved travel to either Jamaica or Puerto Rico. And if you think about that, that reflects the population of New Jersey. This isn't really a surprise. And this is, part of the issues we hear, whether it's with Zika. We've also heard it, by the way, frankly, with lead, where we have, our residents who are returning to visit family in home countries, and they're getting, access, whether it's, mosquitoes, and they're getting infected there. You could take something like lead, where we're hearing from pediatricians, children, have, no traces of lead in their blood, and they return to, family homes in other countries, and they come back with elevated blood lead levels. So we know, because of travel, that we've got to get better from a public health perspective on our messaging to target populations. And for Zika, in particular, we know our target populations are going to be the Dominican Republic, Jamaica, and Puerto Rico, because that's the largest number of our cases. And while we have seen the number of Zika cases decline, with only 4 cases being reported so far in 2017, we need to remain focused in our response. We've had more than 3,500 individuals in New Jersey tested, and so far we have had, as I said, 244 travel-related cases. As a department, we're continuing to focus our efforts on the needs of the most seriously affected population, and that is pregnant women and their infants. We're educating pregnant women about the risk of Zika. We've got the pregnancy registry going, and we're continuing to work with community services like WIC and the Moms Quit Connection, where we seem to have a disproportionate number of women that could potentially be affected, actually accessing services for the department. We continue to collect information for our registry, and we continue to inform community members about Zika and prevention tactics. We continue to update healthcare professionals on Zika transmission, screening, and prevention. Our maternal and child health partners have been critical in pushing this message out, but so have been our partners with ACOG and with AAP. So this is something where we recognize there's a public health response and there's a clinical response. And we need to make sure, in particular, that our clinicians, regardless of where they're located, are having conversations with their patients who are pregnant, who might become pregnant, who are sexually active and aren't taking any precautionary measures to prevent pregnancy, and are involved in international travel to one of the Zika-impacted countries. We continue, as I said, focusing on this. We have also created, and I want to thank some of you here I actually recognized from when we created these Zika prevention kits, coming in and helping out our MRC. We've distributed over 20,000 of those kits to over 112 of our federally qualified health centers and 100 WIC clinics. And we're going to have another 300 kits going out to target the sexual partners of pregnant women who have traveled to areas where Zika virus transmission is still active. And we are now actively working with and reaching out to our seasonal migrant worker community to make sure that they have Zika prevention products and information. So again, this is going to be something that requires efforts from public health, working from a prevention perspective. It's going to require work from our clinicians, and it is going to require the work of DEP and the mosquito control to make sure that we don't have an infected population of mosquitoes here in New Jersey. We continue to work aggressively with our Zap Zika campaign, and I've got to say that's probably been one of the most effective tools, because it turned out that Zap Zika was a universal sort of language word. And so we have had a lot of hits from our social media, which has been really good because that has been the primary source for information. But we continue to use other venues, whether it's going to be radio PSAs, some transit ads, or sharing information through our 800 number. So those are all great tools. We'll continue to use them and make sure that you just drive people to the one source of messaging. We make sure that everything that the CDC puts out is also immediately rebroadcast through the different vehicles. Now, I know a lot of you are sitting there going, I'm just a little confused. What's my role? Okay, maybe not. But I do want to talk a little bit about it because, as I say, your role is critical. You're at the community level. You're seeing where either mosquito pools develop or you're working directly with the most at-risk populations. So please continue what you're doing from an awareness perspective, making sure that your residents know before they go what the risk is and what they can do to manage the risk. And when they come back, we're saying track when you come back. Because if you've been in a Zika impacted area, the risk that you could have the infection and not know it, we know that's actually 4 or 5 cases, right? That you could still be bitten by a mosquito and then infect potentially mosquito pools. So it's really important that you're tracking when you come back, that you actually continue after you return home to aggressively and vigorously use the sort of mosquito repellent products that have been approved by the CDC, and I'm going to have to use the word DEET here, but make sure you're using it. There is a big, there is a big issue if we don't, and we've seen this happen, as I say, down in Florida and down in Texas. We don't want to see it happen here. In addition to that, what we're actually asking you to do is make sure that you continue to check out the information that we're putting out through our different public awareness channels. It is up to date. It will change a little bit as we continue to progress through the season. Make sure that you continue to work with your local mosquito control agencies, with your mosquito surveillance and control efforts that are related to Zika, as well as the other arboviral illnesses like West Nile, and stay up to date on the CDC guidance. Also, as local health departments refine their Zika plans, they should be referencing the department's Zika plan and working with all partners in their jurisdiction, including LINKS programs, mosquito control, OEM, and EMS. We have emergency planning experts in the department. If you need help with your plan, reach out. We'll make sure that we make some resources available to help you out with your plan at the local level. And today, as you go through the workshop, I've got to say, I know that we've got a couple of experts here that can help you think about what you will do if you're confronted with a situation where you need to respond, whether it's from how do you manage communications or, what do you do to actually, identify specifically the area at risk so you can target your mosquito control efforts. We've got great, experts coming in for the other panels. And I'm going to say, again, this is all about coordination, cooperation, collaboration, the 3 C's. The reason why is that we don't actually continue to maintain a safe environment here in New Jersey and maintain an environment where our cases of Zika are only travel-related unless you continue to do so. So we're really fortunate today to have great speakers join us. We are really fortunate to have such a phenomenal turnout. It actually indicates that you again continue to remain on top of the cutting edge issues as well as keeping attention on what are continuing issues. We really appreciate it. Thank you for joining us this morning.